Welcome to our second video on the hypertension series. We are basically creating awareness on hypertension. Please like, share, and subscribe. So before we start today's discussion, just a clarification. According to the new American Heart Association guidelines, the cutoff for diagnosis of hypertension is systolic more than 130 and diastolic more than 80. So please take note of that. Just a clarification. So today's discussion will be on blood pressure categories. So we're going to discuss 4 blood pressure categories. The first blood pressure category is a normal blood pressure. So a normal blood pressure, as we had discussed initially, is blood pressure systolic less than 120 and diastolic less than 80. So for this one, if you have this is a good and a normal blood pressure. The second blood pressure category is elevated blood pressure. So elevated blood pressure means systolic blood pressure of between 120 to 129 and diastolic blood pressure of less than 80. So if you have this kind of blood pressure, the action is to do lifestyle modification. This will be sufficient. The third category of blood pressure is stage 1 hypertension. Stage 1 hypertension is systolic between 130 to 139 and or diastolic between 80 and 89. And for this one, if the patient is low risk and is of age less than 65, lifestyle modification will suffice. Otherwise, drug therapy is indicated for patients above 65 years and in high-risk patients. We will discuss what is high-risk and low-risk patients at a later video. The fourth blood pressure category is stage 2 hypertension, which is defined as systolic more than or equal to 140 or diastolic more than or equal to 90. For this category, drug therapy is initiated plus lifestyle modifications. So those are the 4 blood pressure categories. I hope we have understood and we have gotten the figures right. So the following is just a reminder to us that blood pressure monitoring is very, very important, and achieving the target blood pressure is also important. So as you monitor, we are also looking at the target blood pressure that has been achieved. Also, hypertension is a chronic disease that requires lifelong treatment. It is a chronic illness. Also, the management of comorbidities like diabetes is important as you manage hypertension. Okay, so this is the end of our video today. To create more awareness on hypertension, please like and share our videos. Subscribe to our channel at Pakwa Medical Outreach on YouTube. We are creating awareness. Pakwa Medical Outreach, creating health awareness.